There are several specific bone health protection strategies that caregivers can use in long-term care to promote good osteoporosis and fracture prevention care.
Any histories of fall within the past 6 months?
On admission,
Yes.
residents should be assessed by an interprofessional team for osteoporosis, falls and fracture risk, and appropriate bone health protection strategies.
Oh, did you have
Quite
any
a few.
fracture?
Yes,
Okay.
quite a few years ago.
Having had any type of previous fracture increases residents' risk 10 times for having a future fracture.
How long ago? Did you happen to know year?
Other key risk factors for osteoporosis and fractures that need to be assessed upon admission include the resident's age, family fracture history,
Okay. Well, we
history of falls,
X-ray to see if any
and low bone mineral density.
bit of a bone marrow aspect there. Okay. Just stay there. I'm just going to assess to see the
Signs of a previous spine fracture should also be looked for, including a curved back or kyphosis, a protuberant abdomen, loss of 6 centimeters or more from adult height, less than 3 fingers space between the bottom rib and top of hip. And on the wall test, the back of the head more than 6 centimeters from the wall.
Who is at high risk for fracture? Residents at high risk of fracture based on the 2010 Osteoporosis Canada guidelines include those who have had a prior fracture of the hip or spine, or have had more than one prior fracture, or have recently used glucocorticoids and have had one prior fracture. In addition, those residents who have been identified as high risk and or are receiving osteoporosis treatment prior to admission. It is important to ask these questions on admission, and they are outlined on the slide. It's also very important to highlight that bone mineral density is not required to identify residents at high risk of fractures. If the answer is yes to any of the previous questions, the resident is considered at high risk for fracture. You may be wondering if these recommendations can be applied to frail older adults, not only in long-term care, but also those living in the community. And the answer is yes. There are individuals who are very frail, who live in their home or may be living in a retirement home, who are similar in terms of multiple medical problems and the needs for assistance in activities of daily living, similar to those who reside in long-term care. These guidelines contain valuable and practical strategies to prevent fractures, which will be useful for physicians, caregiver, and residents in long-term care. These strategies include appropriate nutrition and calcium and vitamin D supplementation, use of hip protectors, exercise, and interventions to prevent falls, as well as pharmacological therapies to reduce the risk of fracture. In summary, the goal of these recommendations are to improve the lives of seniors residing in long-term care. First, determine the risk of fracture on admission, asking the questions reviewed previously. Nutrition, calcium and vitamin D supplementation should be considered first. Exercise, hip protectors, and interventions to prevent falls and fracture are also recommended. Consider pharmacological therapy for residents at high risk of fracture. For access to the recommendations and other tools and resources, please visit the following websites: Osteoporosis Canada, Canadian Medical Association Journal, and the Jarrah Centre.